Well, it's a pleasure to be here with all of you today. What Dave didn't mention is that I'm a former child welfare worker here in the state of California. I was a Title IV-E scholar at UC Berkeley, and then after graduating from UC Berkeley, I went and worked in Contra Costa County. Anyone here from Contra Costa County? Woo! I worked in the emergency response unit in Richmond and was supervised by Tony Nestori and Carol Bockelman and had an amazing team of dedicated, supportive caseworkers that I worked with who taught me so much of what I know today, and the work that I did there, the families that I met there, had a profound influence on me and motivated me to go back to graduate school to get my PhD and really shape the work I do today. So thank you all for the work that you do. It's really greatly appreciated, and I know how hard it is. So today I've been asked to come speak to you about qualitative data mining. Many of you are probably already engaged in qualitative data mining, but you might not call it that. As a social worker, I knew that much of the work that we did was documented in systems like CWS, CMS, but wasn't always well captured in the quantitative data or the outcomes reports that we see generated by really fabulous projects like the California Welfare Indicators Project at UC Berkeley, which I also had the privilege of working on when I was a graduate student. But I knew that there was more in that database that we could look at to think about how we could improve practice. So today I'm going to be talking about the qualitative data mining, or the qualitative data that you generate in your daily work, or the caseworkers that you supervise generate in their daily work. And I'll mostly be talking about child welfare, but I think most of this is also applicable to any type of social service, but also probation. So forgive me for drawing on so many child welfare examples versus probation examples, but I'm hoping in the question and answer section of the talk that those of you in probation can think about how this work will be applicable to your own. Okay, so to begin, as many of you know, in daily practice of social workers or social service professionals, they collect and record large quantities of data about client characteristics, practice interventions, and client outcomes. While documentation of service activities is not new, over the last 30 years, federal and state legislation has promoted increased documentation. Consequently, administrative data has proliferated, and administrative data systems, such as CWS, CMS, have made these data more accessible for research and evaluation purposes. Many in this room already use these data stored in administrative data systems in your CQI practices and processes. CQI advises that agencies use all available data sources to inform their improvement. In child welfare, these likely include administrative data sources such as CWS CMS, WebSDM, Safe Measures, or the reports you're generating by business objects. So to date, administrators, practitioners, academics have made really good use of the quantitative data stored in these systems. These quantitative data, numerical, categorical, structured data, help agencies to identify rates of reported and substantiated child maltreatment, detect corresponding risk factors, or categorize service responses. The mining of these data teach us about the kinds of maltreatment, placements, and services children referred to child welfare systems experience. They identify the frequency of these experiences and can be used to make predictions about which children will return home and which will remain in care. A quick review of available data on the California Child Welfare Indicators website demonstrates just how powerful and illuminating these data are. So if we look here, between 2008 and 2018, we see that there's been more allegations of child maltreatment, but fewer substantiations, lower rates of entries into care, and fewer children and youth in care overall, right? These data give us quick feedback about how we're doing as a system, areas where we're succeeding and areas where more progress needs to be made. But these quantitative data tell us little about how workers define abuse and neglect, why children are placed in specific settings, how children and families are engaged in services, or why some children are unified while others linger in care. These latter how and why questions are better answered through the mining of qualitative data. So what do I mean by qualitative data? Typically, when we think of qualitative research, for those of you who are remembering back to Social 101 or psychology classes, we often think of interviews or participant observation. Such research seeks to generate new data to give us a better understanding or insight into or really how to make meaning of a specific phenomena or behavior. Qualitative mining relies on existing data. It mines the worker-generated, unstructured, narrative text contained in administrative data systems from practice documents. In child welfare, these documents might include maltreatment referrals, investigative narratives, risk and safety assessments, court reports, or daily contact notes. Mining and analysis of these data allow us to deepen our understanding of practice, client populations, and social problems, and help us really identify new emerging issues in the field that aren't already captured in categorical data. So some of you may already be engaged in a type of qualitative data mining through your work in the Children and Family Services Review. Federal and state CFSRs require agencies to conduct regular case record reviews, which I'm sure many of you are well aware of and doing. The on-site review instrument guides the reviewer through the case, checking to ensure that agencies are complying with federal and state rules and making sure that safety, permanency, and well-being benchmarks are being met. Was the investigation conducted within the required time frame? Were siblings placed together? Did the worker have regular visits with the child? Well, the CFSR review does ask the reviewer to sometimes reflect on things like family strengths, promising or troubling practices, systematic issues, or other concerns that emerge from the data. Overall, this review instrument is something that we call as researchers deductive. That is, the structure of the analysis is operationalized on the basis of previous knowledge, meaning it's telling you what to look for. Rather than reporting on the information that you're gaining through the review independently. Does that make sense? Okay. So for example, in this question, the instrument asks, why was the case open for services? So the reviewer then must choose from a limited menu of reasons. And here we see that the reasons go beyond just the types of abuse and offer some other factors that might be contributing to the opening of services. But in general, it's saying, was there physical abuse, sexual abuse, emotional abuse? Is this the reason that the case has been opened? But what we all know is that nested within these large abuse categories, or these broad abuse categories, are a range of acts and omissions, right, that aren't captured by the term neglect. So is neglect a deprivation of basic needs? Is it a failure of protection? Is it a lack of supervision? Is it an exposure to a harmful or illicit substance? And more importantly, to the work that we do, what are the underlying conditions that resulted in the neglect? Why was the child deprived of this need? Why did a parent not provide proper supervision? How did an exposure to an illicit substance or prescribed substance adversely affect a child at the time of their birth? To answer these latter questions, and to move beyond compliance as CQI requires, we must not only ask these what questions, but we must also ask these why questions. We must employ not only deductive methods of analysis, but also inductive methods to surface new knowledge that's stored in these data. And really to surface the knowledge that's stored within the workers themselves, right? There's this great phrase, and I hope I'm gonna get it right, that not everything that counts is counted, and not everything that counts, and not everything that counted counts, right? But one of the things I want to do is that we might not be able to count all the qualitative experiences and the good work that social workers are doing, but how do we get closer to understanding what that good work looks like so that we can train other social workers in child welfare or probation to do that work? And qualitative data mining helps us capture and illuminate those practices so we can transfer that knowledge to others. So when might we want to use qualitative data mining? So you might want to use qualitative data mining when you seek information about something not captured in the categorical or qualitative data. You want to explore a topic which little is known about. You want to really get inside that black box of practice, programs, and interventions. You've reached an impasse in explaining or understanding with the quantitative data you have alone. Or you want to study complex processes, and really, what's more complex than social services? So now, thinking about what does qualitative data mining look like in practice, thinking about how you might go about answering some of these how or why questions. What's really important is that you need to work with your agency to develop a plan on how you will use QDM. What qualitative data do you want to look at and why? Where might you find that in your administrative data system? And how will you systematically analyze and make meaning of that data in your review? So in 2003, when I was still a student at UC Berkeley, I partnered with Drs. Mike Austin and Sarah Carnican in the Bay Area Social Services Consortium. Is anyone here who's part of BASC? Okay, great. So the Bay Area Social Services Consortium is a regional social services consortium involving 11 county social service agencies to explore how QDM could be used. That's what the consortium is made up of. And together, we decided we wanted to explore how QDM could be used by agencies to better understand and enhance practice. The goals of the project were twofold. First, we wanted to develop QDM techniques that could be replicated by other agencies and research partners, and then we wanted to develop a qualitative database that could be used for practice research. From this project, we developed a 7-step guide that summarizes the QDM strategies and the methods developed. In this guide, we provide a roadmap on how qualitative data can be identified and mined from administrative data systems, and suggest a range of analytical techniques that can be used to examine and understand these data. The approach should be driven by the types of questions asked and the overarching goals of the project. We adopted 2 primary data analysis strategies. These included code-based analysis and case-based analysis. Code-based analysis can be both inductive and deductive, and it's excellent to use when you're trying to identify the needs of a specific population or problems, or you're trying to identify actions and inactions, for example, like what the worker did or what they did not do. Case-based analysis can be done within or across cases. This is a good analytical approach when you're trying to understand the complexity of a specific case or trajectories across cases, or how these trajectories compare across cases. Using these techniques, our team worked with BASC agencies to complete a series of practice research papers using QDM techniques and answering the types of qualitative questions that I previously highlighted. So in that nice app that many of you downloaded before you came here, we have included this article using qualitative data mining for practice research. So if any of you want to have more details, you can check that out or come to one of our workshops later today and learn more about the nuts and bolts of QDM. But now I just wanted to give you some examples of some of the work that we've done using QDM techniques to better understand practice. Okay, so if we take something like this, you're exploring a topic about which little is known. So one of the areas that we were interested in was domestic violence. So we all know that domestic violence occurs in high rates among the families we work with in child welfare. Studies find that about 1/3 of child welfare-involved families have experienced domestic violence. But we know little about how child welfare workers respond to allegations of child exposure to domestic violence, and if in practice, child welfare workers treat child exposure to domestic violence as a type of child maltreatment in itself. So advocates in the domestic violence community have long been concerned that adult victims of domestic violence, predominantly mothers, are blamed for failing to protect their children from exposure to domestic violence, and as a consequence are substantiated for maltreatment. Many of you probably have heard this. Many of you probably had these conversations in your counties. However, our systematic review of the qualitative data from one county found that this was not the case. Using a random sample of case records for a 1-year period, our study found that CEDV often, or child exposure to domestic violence, often did trigger investigation, and it was construed as a type of neglect at the time of investigation. However, at the time of case disposition, it was not construed as a safety threat, and few allegations were actually substantiated for maltreatment, and in no case were children removed for child exposure to domestic violence alone. There were always other contributing factors. Instead, most families were referred to community-based domestic violence services. Now, this is a really important finding and a really important conversation to have with the anti-domestic violence community, but it also has to help us think about how we might change our practice. We know domestic violence does adversely affect children, but if we're not bringing those children into the system and we're diverting them to the community, how can we divert more of those cases away from the system at the start if we're not going to bring them in? Or how do we make sure those links from child welfare to the community are stronger so these families aren't coming back to us, right? So if we take another question, you wish to get inside the black box of practice programs or interventions. One of the counties was interested in parental substance use. Again, parental substance use affects many of the families that come to the attention of the Child Welfare Agency. Some researchers estimate or studies have found that 40 to 80% of all child welfare cases involve substance use, or it's a contributing factor. But again, substance use itself is not defined as a type of maltreatment. So how do child welfare workers or their agencies make the case to the juvenile or family courts that parental substance use related acts and omissions are harmful to children? In this study, we use both deductive and inductive methods to explore ways that workers drew on child maltreatment statutes, risk assessment tools, and practice guidelines to frame evidence and make the case that PSU is harmful and poses a substantial risk of harm to children. Narrative data were extracted from child welfare court reports located in electronic case records from 2 different California counties. The analysis revealed that workers cited multiple sources and types of evidence to make the case that due to substance use, parents had failed to protect their children from harm, had failed to provide for their children's basic needs, and that this failure constituted neglect under California law. In addition, similarities and differences emerged within and across counties in how workers made that case, suggesting that state and local policy practice guidelines did influence the structure of court reports and arguments made for state intervention. I know when I was a child welfare worker, much of my training on how to write court reports was by reading the court reports that other people in my unit had written. Some people wrote excellent court reports, and some people I don't know, all the court reports I read I think were quite excellent, but I don't know what all the court reports looked like. But I know some people were called in front of the judge to clarify what was in the reports more often than others. So how do we help social workers write more evidence-based or evidence-supported court reports so they can spend their time out with their clients rather than in the courtroom justifying what's in their report? And so one of the things that was revealing to us in reviewing these reports, that the quality of reports really differed, and how can we invest in training to help social workers write more convincing reports to the judge, or to document the practice that they're doing or what they're observing in the field to really demonstrate the need for child protection. You've reached an impasse in explaining our understanding with quantitative data alone. So this is not a study that I did, but I think this is a beautiful, 2 beautiful studies that I wanted to share with you that illustrate how qualitative data mining can complement quantitative data mining. So in a recent paper published by our friends at the Children's Data Network at USC, Doctors Andy Eastman and Emily Putnam-Hornstein, who I think was here or will be here, linked quantitative data from child welfare and vital statistics to determine if some children born to mothers in care, so meaning mothers who are in foster care, were at higher risk of child welfare involvement than other children born to mothers in care. Their 2-generation analysis found that about half of children born to mothers in care were subsequently reported to CPS. So this proportion is much greater than the general population. But they wanted to know if risk factors differed across these mother-child dyads, and they found that they did. So not all mothers who give birth while they are in care are at equal risk of being reported to having their child reported to Child Protective Services. They found that non-minor mothers, that is, mothers who are in care but 18 years of age or older, right? So the youth who have decided to stay in care after age 18, with stable placements were much less likely to have their children reported to Child Protective Services than minor mothers, those under 18, who were in unstable placements and had mental health conditions. So only 30% of mothers in that first group were reported to CPS versus 70% of mothers in that latter group. But why? So all of you are in here, you probably have some hypotheses about why one of those groups would be reported at higher rates than the other, but Dr. Eastman really wanted to drill down and get a better understanding of why these groups differed. So this is something that the quantitative data couldn't answer. So wanting to understand the why behind the what, in a subsequent study, Dr. Eastman and her colleagues mined the narrative data from a subset of these mothers to examine the reasons described behind the CPS involvement among these children who were born to these mothers in care. They found important differences between the two groups. So in the non-minor mother group, CPS reports were typically made due to concerns about general parenting skills, and there was evidence in the record that this might be reflective of surveillance bias, right? So these mothers were young mothers, they were coming into contact with social workers on a regular basis, CPS social workers on a regular basis, so they were more likely to be reported because of concerns about parenting skills, but not really serious child welfare concerns. These mothers were much more likely than the other group of mothers to have strong social support. They were more likely to cohabitate with the fathers of their children or to be engaged with them. Whereas the mothers in the unstable placements, who also had documented mental illness, were much more likely to have serious maltreatment concerns. These reports were much more likely to involve substance use as well as mental health concerns. These mothers lacked social support and had very little engagement, if no engagement at all, with the fathers of their children. And many of these mothers had had negative and sometimes abusive experiences in care that led them to discontinue use of services or try to exit early from the foster care system. These data point to a heterogeneity, sorry, I'm having a hard time, heterogeneity, pronouncing that word. So these data were pointing to a diversity in this population and that the need to tailor services to this population requires a diverse set of service needs, that one size will not fit all, right? So in the aforementioned studies, we can see how QDM can extend our insight of understanding child welfare populations. It generates new insights that could not be gained from quantitative data alone. The QDM studies I discussed here with you today actually all relied on manual coding of the data, but there's new developments in automated text analysis and machine learning that may allow us to expand QDM level analysis to population level data. And we believe that few people are better positioned to engage in qualitative data mining or QDM practices than those already working in the system. QDM really requires a working knowledge of these systems. It requires knowing how data are mapped in these systems, how information is connected across many documents, and how to interpret the many, many, many acronyms and non-descriptive agency service names that are included in this record. So many acronyms. Qualitative data mining can also be used to enhance training of existing workers and future workers. So engagement in qualitative data mining can also serve as a valuable training tool for child welfare staff. Through engagement in QDM, staff become both producers and consumers of practice knowledge. Rarely, in my experience, in talking to many MSW students and many child welfare workers, do staff have the opportunity to read through an entire case record. Analysis of qualitative data allows staff to examine how a case unfolds over time, how persuasive argument can be made to the court, how you can better meet client needs, and how to document daily practice. QDM can also be used to educate future staff members. For example, in our own work, we recruited and trained MSW students to help with the extraction, organization, and analyses of these data. Many of them were Title IV-E students, and this helped them ahead of time become familiar with CWS and CMS, clients' needs, promising practices, and the complexity of the work. So we recently published a book called Public Child Welfare, a casebook for learning and teaching. And in this book, and it's available for you to look at here if you're interested, in this book we generated 20 real-world practice narratives to help child welfare workers, both current and future, to better understand practice. And we think this is a really helpful tool because I think oftentimes we're trying to come up with examples on the fly, and we don't always have access to the records to show people, but these are all real case records where we've taken out all identifying information that really illustrate the challenges of practice. So, in summary, we believe and have found that the qualitative data stored in CWS, CMS, and in other administrative data systems are a real treasure trove of knowledge, that we can utilize this data to better understand and enhance agency practice. We can foster new knowledge about client populations and emerging problems. We can generate new knowledge about practice, case complexity, and the factors underlying system outcomes, and we can complement and enhance the CQI process. This will contribute to our continuous learning and practice outcomes. So we hope that many of you can join us later today for a QDM Nuts and Bolts workshop if you want to know more about how you can do this and how you might do this in your agency. And these are the additional resources that you can take a look at if you're not able to come to that workshop. And thank you all for your time, and I'm happy to answer any questions that you have. I know that was a lot of data to cover, or a lot of ground to cover in a short amount of time.